Without further ado, let's get this KSA Telehealth Technology Summit 2022 started with the first keynote by Dr. Dari Alhuwail, Associate Professor, Information Science Department, Kuwait University, on implementing digital health innovations, technology, governance, and society. Over to you, Dr. Dari.
Thank you, Satish. Bismillah ar-Rahman ar-Rahim. I'm honored and super thrilled to have the privilege to be one of the speakers in today's very important conference, the KSA Telehealth Conference. So the title of my presentation is Implementing Digital Health Interventions, Technology, Governance, and Society. I'm proud to be a faculty member at Kuwait University, but I also wear and hold many, many different hats with many of my colleagues who will be joining me in the panel, as well as, throughout the conference. And I'm super delighted and excited to be sharing some of these moments with you all. Just before I start, I just wanted to have some disclosures. So I have nothing here to declare that could be perceived as a conflict of interest. All the views, opinions expressed in this presentations are really solely mine, and they do not reflect any position or policy of any location or workplace that I work for or do some consulting work with. Unless otherwise stated, I borrowed the images from the wonderful Google search engine, so all the copyrights remain with the owners. So I just wanted to state that very clearly. So in terms of an outline, just like the title says, we're going to be talking about technology. We're going to be highlighting some issues about governance, sort of ending it with society. And I'm super honored and thrilled that I will be joining a fantastic group of experts, and we're going to be, sort of tying this together. So if you will, this is more of an appetizer or a teaser to, hopefully the fruitful discussions that are yet to come. Now, all of you, realize, especially here in the Gulf Cooperation Council, right, the GCC, that we face extreme pressures when delivering primary care services, and healthcare services in general, right? The healthcare spending is set to reach 60 billion by 2025. That's a huge number, right? And unfortunately, we're also seeing or experiencing some disparities in terms of quality, accessibility, cost, and we also have a large migrant population. Without this, these fantastic workers, we're not able to achieve, all the advancements and fantastic frog leaps that, many of our countries have been experiencing recently. The regional governments are also really, really stretched financially, right? And especially nowadays in a turbulent economy with all that we're facing, and not to make, the presentation political, but you all have seen and continue to see what inflation is doing, the economic as well as the political instability that we're facing. And it goes without saying that the healthcare sectors requires huge efficiency to drive in the region. And there are excellent and amazing pockets of excellence. And I always tell my colleagues, the Kingdom of Saudi Arabia is a stellar example for not only the region, but internationally and globally in terms of, what they've achieved and continue to achieve, mashallah. However, right, these challenges, not being, super pessimistic, but also being optimistic, digital enters, right? So we have rapid developments and advancements in information and communication technology, whether on the software level or the hardware level, and, gadgetry. And we're seeing this, increasingly and rapidly developing. We're also seeing a lot of our consumers, right? And I like to call them consumers. Sometimes maybe other people call them patients. A lot of them are really digital natives, and they're looking for the digiceutical, not the pharmaceuticals, but the digital solutions that can help them. And, it goes without saying, but we're in the GCC, right? But data is the new oil. While this might be a threat, right, to our traditional oil, I think it's also a fantastic opportunity for us to leverage. So, just keep these in mind. Now, the opportunity comes that, a lot of the governments, insurers, patients or consumers, right, they want to reduce their costs. We want to provide real-time access to care. We want to overcome issues of geography, transportation, improve workflows, as well as diagnosis. What about the burden of, visiting the emergency room, right? And the list goes on. So there are a lot of fantastic opportunities, and we're seeing a lot of advances, right? So this conference is labeled as the TELEHEALTH KSA conference, right? So telehealth, telemedicine, mHealth, right? And the list goes on and on and on. And I'm sure the speakers prior to me and the speakers that will be, afterwards, they will absolutely highlight these issues. But there's, huge opportunities to be exploited. And I can tell you from our own research that, we're fortunate to have high EHealth literacy rates. So our population is ready, right? They're ready to be engaged digitally. But also, unfortunately, when it comes to our presence, sometimes online and the information online, and this is another study that we did, right? The health websites or the health information that are on these websites are considered, what we would like to label as rudimentary. So there is a huge opportunity for improvement in that sense. And like I said, there are many gaps that, exist within, whether it's the information, whether it's the apps that are available, and in comparison to those apps that are available in different languages and primarily in the English language. Also, there is limited or lack of evidence-based Arabic content out there. And this is maybe my plea as a researcher, as a scientist, to my fellow researcher, my fellow scientists, as well as, also providers, clinicians, and companies out there, developers, right? We need to do more efforts investigating these digiceuticals, right? To have them associated with evidence-based practices, and that we can ascertain to a high level of confidence that these are backed up by evidence and they do actually work. Away from the buzzwords that we keep hearing, in terms of this application or this tool is backed up by artificial intelligence and blockchain and all these fantastic, great technologies. We need to back them up with evidence. Also, I believe there is early evidence of leveraging the power of data and integrating it into supporting the decision-making. And we're seeing, again, a lot of really good examples from within the region. However, we need to have this increased. And this is where I think, again, coming in and looking at the governance piece and looking at how can we really leverage data being the new oil. So a lot has to do with the technology governance as well as the data governance. And maybe my plea and argument here is looking at it from a learning health system perspective. And I apologize, but I do not have enough time or ample opportunity to go through what a learning health system is. But hopefully this would be homework for all those that are attending and watching. But in terms of the learning health systems, what we really want to do is take our performance to data. So we document this. We go and transform this data to knowledge to be actionable, and feed this knowledge into our practices, right? And make sure that these practices are being formed. Now, also importantly, what we need to do is form our learning communities around this. And when we talk about our learning communities, it's super important to involve the society, to involve sometimes what we label as the least utilized resource in healthcare, the consumers or the patients, right? So the consumers have, and the society has a major role, and we should not discard that. And I believe the COVID-19 pandemic is a major health crisis had highlighted that. The image that you see here is an initiative that we took here in Kuwait, highlighting the power of geographical information systems, or GIS, and people volunteering their own information, right, to make aware their society and their community around them that these are the, if you will, the symptoms that they're experiencing, hopefully encouraging people to stay safe and to stay home, right? So there is a lot that we can do on the spatially enabled side of things. But also, we need to make sure that, these citizen science approaches are really effective, right? there are many different fields, especially in the environmental side of things. The citizen science approach really worked, and we need to ramp up our efforts, especially in this part of the world, and include our society in our research as well as our consumers. So I'd like to sort of leave you with some key takeaways. We need to have appropriate guidelines across the GCC for certifying digital health contents, including health apps. We need to create advisory groups, and super importantly, to have these advisory groups represented by consumers and patients. And we need to investigate how to better engage all these stakeholders in using these digital health tools. We need to create appropriate governance, including information management, legal, and super important, ethical. We need to think about learning health systems and how can we have these learning health systems put into action, and never, ever underestimate the least utilized resource in healthcare, the patient or the consumer. At the end, I would like to say that we need to keep people at the center of our work and involve them throughout the process, whether these are our clinicians, our policymakers, our consumers. Data and technology governance is not an easy task, although I may have made it sound like it's a breeze, but I'm sure in the panel discussion, we're going to highlight and discuss some of these. The dynamics of the market also add, to this complexity, not to say that healthcare is easy and straightforward, it's pretty complex. But we need to recognize there's still much more work to be done, but this is what the exciting part that, I encourage you all to join us, and join hands in this wonderful and fantastic journey ahead of us. So I'd like to tell you that we have more opportunities, to be discussing this with my fantastic colleagues here in a little bit. So stay tuned, and I'll leave you with my Dilbert cartoon here. This is my contact information and my social media handle, and I look forward to meaningful and fruitful engagements. Thank you very much. Back to you, Satish.
Thank you, Dr. Dari, for the insights and invaluable knowledge imparted with us today. I'm sure our delegates would have captured some great key takeaways from your insightful keynotes, such as having a healthcare advisory group and having corporate governance and much more. See you at the panel.